Good afternoon, everyone. It's 2 o'clock and time to start today's briefing. On the panel, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, and Kirsten Johnson, Commissioner of Health for the Milwaukee Health Department. We will provide a Spanish language interpreter at the end of the briefing. County Executive Crowley, we'll start with you.
Well, thank you so much, Sydney, and good afternoon to everybody. We have some big news today. The state of Wisconsin just announced that starting Monday, March 22nd, anyone with chronic health conditions is eligible to get the COVID-19 vaccine. And we truly appreciate the state taking the necessary steps to open up eligibility to get more shots in arms and minimize barriers to receiving the vaccine. And locally, in partnership with the state, Milwaukee County, and the city of Milwaukee, are taking eligibility one step further. So starting on Monday, all individuals with a chronic health condition will be eligible to receive the vaccine, and anyone 18 years of age and older and who lives in the 10 county zip codes ranking highest on the CDC's Social Vulnerability Index can get vaccinated. And these zip codes include 53204, 05, 06, 09, 15, 16, 18, 23, 24, and 33. I'll say it again. Starting on Monday, all people ages 18 and older who live in these 10 zip codes will be eligible to receive the vaccine. That's 53204, 05, 06, 09, 15, 16, 18, 23, 24, and 33. A lot of numbers. But if you want more information, go to milwaukee.gov/COVID-VAX, that's COVID, VAX, or covidmke.com to make an appointment. Milwaukee County and the city of Milwaukee have declared racism a public health crisis. And we recognize that structural racism causes chronic toxic stress and which leads to other serious conditions that impact the health of residents. So we value the state for working with us to address the dramatic disparities we're experiencing locally, particularly when it comes down to equitable vaccine distribution. And utilizing the zip code data to expand our vaccine eligibility in targeted areas is a step in the right direction towards serving our underrepresented neighborhoods of color and instilling confidence that they will be treated with equity and respect in our healthcare system. But I want to be clear, this expanded eligibility is not just for communities of color. This eligibility is for our communities that rank highest on the CDC's Social Vulnerability Index. And the index is based on social vulnerability populations that are especially at risk because of factors like socioeconomic status, household composition, minority status, or housing type and transportation. And Dr. Weston will provide more details about this index and how these 10 zip codes were selected. And also have more good news to share about the steps Milwaukee County is taking to address vaccine equity in our community. Our Office of Emergency Management, the Department of Health and Human Services, Division on Aging, and other local partners are working to ensure our homebound seniors have easy access to the vaccine. So starting today, our partner, Goodwill Industries of Southeastern Wisconsin, will deliver a flyer along with its daily meals to 1,500 homebound older adults with information about how to register for a vaccine shot. And the flyer delivered by Goodwill drivers will provide a phone number that individuals can call to get vaccinated. The phone number is staffed by Health Connections, which is a local health provider with a special focus on vulnerable populations that traditionally experience barriers to accessing healthcare. And so Health Connection staff will then be able to provide a vaccine in the convenience of our seniors' own homes. And homebound adults, older adults who would like to get scheduled to schedule their in-home vaccine can call 414-999-1019. I'll say that number again, 414-999-1099. And with all the news that is encouraging out there, it does not mean that we can let our foot off the gas. We must remain vigilant, and we must continue to follow the 3 W's, which is wash your hands, watch your distance, and wear a mask, and continue to avoid large gatherings and stay at home when possible. And because St. Patrick's Day is tomorrow, I want to encourage everyone to support your local business by ordering food to go or by celebrating the holiday, keeping safety practices in mind. So stay outside if possible, maintain physical distance, and wear a mask when you're not eating or drinking. And we must continue to be vigilant in our own individual efforts to keep our loved ones and ourselves safe. So please consider how your actions during this holiday may affect those around you. And with that being said, use this time to relax and enjoy the day tomorrow. And with that, I'd like to hand it over to Mayor Barrett. Mayor Barrett.
Thank you very much, Mr. County Executive. Good afternoon, everyone. I want to start off by talking about FEMA, which is very, very related to the changes that we're making that are going to address a lot of the issues that the county executive referred to. But I think it's important to put all this in a context. Monday, vaccine administration at the Wisconsin Center was taken over by the Department of Homeland Security's Federal Emergency Management Agency, FEMA. So FEMA is now essentially operating that site. I'm happy to report that things have been running very smoothly during the first 2 days. We have had great partnerships with a number of federal agencies and volunteers. The organization team Rubicon has been particularly helpful here. By adding FEMA presence at the Wisconsin Center, and this is very important, we can now deploy some of our health department workers to community sites. So again, this is a signal that this partnership with the state, with the federal government, with the county, with the city has allowed us to, in essence, go forth and multiply, because now the FEMA workers will be operating the FEMA site. So what happens to the city of Milwaukee workers? Well, you're going to hear more from Dr. Weston, and you're going to hear more from the commissioner as to the reason we asked the state to work with us to get more individuals vaccinated. But to make a long story short, and others will go much more into depths about this, is that when we saw the model late last Thursday that showed those zip codes that had the highest challenges, for lack of a better term, and Dr. Weston will use a technical term, but the highest challenges, we saw that those same zip codes were the zip codes that had the lowest vaccination rates. The zip codes that were the most prosperous were getting the highest percentage of people vaccinated. So we know that there's a social vulnerability index that the county executive referred to that's been crafted by the CDC that looks at a number of factors. And based on this analysis, again, we looked at these zip codes and we saw that the zip codes that had the highest social vulnerability index numbers were the ones that had the lowest vaccination rates. In other words, the people who were in the neighborhoods that needed it the most were the ones that were getting it the least. This led to a flurry of phone calls starting Thursday, Friday, Saturday, yesterday, today, with the state of Wisconsin, asking them to help work with us to address this issue. And I'm pleased that with the cooperation from the state at our urging and the county's urging, the governor today has made the announcements that he has made. I think what's also in play clearly is that there are more vaccinations coming to the state. And the governor, as well as the Department of Health Services, are trying to do everything they can to get the vaccinations into people's arms. That's why Wisconsin numbers are so high. But we knew that there was a problem here over the last month and a half where the Milwaukee numbers were low relative to the rest of the state. And when we saw this social vulnerability index, we were able to pinpoint that this was part of the problem. So this week, in response to that, because we wanted to make sure when we announced that there was this problem, which we just learned of Thursday and it's being released today, that we had a solution at the same time. So what we're announcing today is that the city of Milwaukee will expand our campaign to bring COVID-19 vaccinations to Milwaukee's neighborhoods. Today, we're rolling out a mobile vaccination plan focused on racial equity. The urgency behind the plan, as I said, was turned up this week based on the preliminary data on vaccination showing this significant racial disparity in vaccination in Milwaukee County. The same pattern in infections and deaths that marked the start of the pandemic are slowing what should be the end of the pandemic in the city of Milwaukee. And this isn't fair and it's not acceptable. So the city of Milwaukee, in partnership with the county and the state, is taking immediate action to address this issue for our residents. The health department has already partnered with churches, shelters, and community organizations to schedule mobile vaccination sites like All Saints and St. Ben's. But our new mobile site plan will target the 10 zip codes that the county executive referred to, which are the 10 zip codes that have that are highest on the Centers for Disease Control Social Vulnerability Index. Throughout the pandemic, my administration has worked on all fronts to minimize racial disparities, ensure that communities of color in Milwaukee are heard and supported. From the beginning of the pandemic, we prioritized testing access, economic, and constant communication with Black and Brown residents and leaders in the city. And we're going to continue to do that. So what we're doing is we are fine tuning the distribution, and we're making sure that we're getting the vaccinations into the neighborhoods where we need them the most. Again, the other good news that the commissioner and the doctor will talk about is the acceleration to next Monday of these next groups. Initially, it was going to be March 29th. Given the supply that the state has, they've been able to move that up to March 22nd. That is very significant news, as is the news that we'll be able to take this neighborhood approach to address these racial disparities that we see. Finally, I think it's important to keep in mind that testing continues. And I want to provide an update on our COVID-19 community testing numbers as of Monday. We had 490 people Monday at American Family Field, the old Miller Park, 80 at Northwest Health Center, 83 at the Southside Health Center. So please continue to seek testing if you are experiencing symptoms or think you may have been exposed to someone who has tested positive for COVID-19. I also want to give a shout out to the Brewers because they've been great partners in our testing efforts. If they play baseball as well as they've partnered with us, they'll win the World Series. We're grateful for them for allowing us to use the field as a community testing location. I will share that there is planning underway to transition American Family Field from a COVID-19 testing site to a vaccination site in the near future when we can do outdoor testing outdoor vaccinations because the weather will permit us to do so. But right now, testing is still available at our Northwest Health Center and Southside Health Center, Monday through Saturdays, 9 a.m. to 2 p.m. Healthcare providers also continue to have a great deal of testing capacity and a great number of vaccinations as well. So to access a map of current testing locations, you can visit milwaukee.gov/coronaresources/COVID-19 testing. So a lot of information today, but a lot of good information today. And it's resulted because we've had this great partnership here at the local level and with the state of Wisconsin. And with that, I'm going to turn over to Dr. Weston. And I want to give a shout out to Dr. Weston today because he was really the one that developed the map that I hope he's going to be talking about. That's going to really explain why we felt this urgency and why we felt once we knew there was a problem, we felt we had to come forward not only with the problem, but also with the solution. And that's what we're doing today. So with that, Dr. Weston.
Thank you, Mr. Mayor. I appreciate that. And on the topic of the map, credit also goes to Dan Pojar, Shannon Grauman, and Zach Swingen from the Milwaukee County Office of Emergency Management, the brains behind the map. So starting off, first to our numbers, we are currently seeing an average of 63 new cases a day of COVID-19 and are now down to about 1 death every 2 days. We've talked about and have known since the weekly data became available that there are substantial racial and ethnic disparities in vaccine administration. And based on that knowledge, we in the county and the city and the health departments have taken steps to narrow that gap, including community clinics, targeted messaging, and zip code specific programs. However, today with the release of the EVE model, which stands for Evaluating Vulnerability and Equity, we have a much better view and understanding of not only how stark the disparities are, but where they are occurring, allowing for better targeting of resources and messaging. The EVE model assesses communities based on 2 factors. First, the CDC's Social Vulnerability Index, and second, the community's vaccination rates. We're therefore able to identify the most at-risk communities, those with both a high vulnerability level and a low vaccination rate. And this model and its outputs are now online on our public-facing county dashboard under the tab for EVE model. And indeed, the data from this model shows us very concerning findings. However, in light of these findings, we're pleased to have worked with the state to address these trends. The state is working to address these disparities head on by moving up that eligibility date for those with chronic conditions to this coming Monday, March 22nd, a week earlier than initially anticipated. This will introduce an extremely effective and extremely safe vaccine to many, many more in our community. However, we want to take a step further. We understand in Milwaukee County, as with countless parts of the world, as well as our country and our state, systemic racism affects the lives of our citizens in a multitude of ways. In addition to the financial and social effects, it has clear effects on the health of individuals living in the most affected communities. It's for that reason, when considering the connections between race and ethnicity on chronic stress, on health inequities, and ultimately on poorer health outcomes, that we'll incorporate these health impacts into the health conditions that are eligible for vaccine. So using the validated and widely utilized CDC criteria of social vulnerability index, will open up vaccine eligibility to the 10 most vulnerable zip codes in Milwaukee County. They were selected by averaging the CDC's social vulnerability index of each census tract within a zip code using methodology from the US Department of Housing and Urban Development. And these 10 zip codes can be found on our county vaccination website, covidmke.com. And at that website, you can also, starting right now, right this moment, schedule an appointment for your vaccination at our site at the Kosciuszko Community Center. So to be clear and to summarize, starting Monday, anyone with a state-recognized health condition can get vaccinated. No matter what your zip code is, anyone can get vaccinated. And this includes those, among other health conditions, those that are even mildly overweight. And in Milwaukee County, to address the inequities and disparities in our community, also starting on Monday, in those 10 target zip codes, anyone over the age of 18, anyone over the age of 18, or 18 and older, I should say, can get vaccinated. You can go to covidmke.com to schedule your appointment right now. But we are one of many sites. You can also visit the city's website and schedule an appointment. You can go to one of the many other public health, healthcare, community health center, pharmacy, vaccination sites throughout the county. Check their respective websites to better understand their geographic eligibility. And we will continue to follow these disparities. We now have a tool in the EVE model to more deliberately target our messaging and our resources. The disparities are there, they are real, and they are stark. It will be a tremendous challenge to overcome them, but this model, coupled with the zip code program, will be an enormous support in enhancing the equity in vaccination in our community. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson.
Good afternoon. I want to start by thanking FEMA and our federal and state partners for supporting our efforts at the Wisconsin Center. As of yesterday, we are vaccinating eligible individuals who live or work in Wisconsin. On March 22nd, as mentioned previously, eligibility will be increased to anyone over the age of 16 with underlying health conditions. Because of our partnership with FEMA, the Milwaukee Health Department is able to mobilize our staff to address these significant disparities in vaccination rates that we knew existed and have now been highlighted through the work of the EVE model and with Dr. Weston. So our focus at MHC now is heavily on our community-based sites. We are very thankful to the governor and DHS for recognizing the need we have to address the racial inequities in Milwaukee. Starting on Monday, the 22nd, we'll be running 3 enduring community sites. The first 2 at North and South Division High School will run from March 22nd until April 19th, Monday through Friday from 10 a.m. to 4 p.m. An additional site at Northwest Health Center will also be mobilized in the next week. After April 19th, the Northwest Health Center and the Southside Health Center will be our enduring community sites. The Milwaukee Health Department enduring sites will be walk-in only. I say this with a note of caution. We recognize the demand exceeds our vaccine inventory, and we want people to be aware there may be wait times. However, we do expect more vaccine every week. In addition, we will be offering smaller community sites throughout the priority zip codes in partnership with community organizations. Our intent is to offer 2 additional smaller sites every day. Registration for those sites will be led by the community partners. Community site vaccine is only available for individuals from our priority zip codes and the neighborhoods where our community sites are centered. All eligible individuals are asked to register at the Wisconsin Center or through their provider or other vaccinators. Registration for other sites in the city of Milwaukee can be found at our website at milwaukee.gov/COVIDVax. Those with questions or who do not have access to internet can register or call 414-286-6800. This week, we are providing 2,000 doses to our community sites, primarily focused on shelters. We are also partnering with the Greater New Birth Church and Milwaukee Health Services, Inc. on Friday to provide a community site. At a minimum, we will be providing 2,000 doses per week at our community sites. Next week, we anticipate to have 2,700 doses. In addition, on Thursday, March 18th, we will be releasing our newest health order. As we continue to see a downward trend in the number of cases, we are cautiously optimistic that we can begin to loosen some restrictions. The order will go into effect on Friday, March 19th. And finally, although I know we are all anxious to celebrate St. Patrick's Day, please exercise caution, practice social distancing, and wear your mask so we can continue to trend in the right direction. Thank you.
Thank you, Commissioner Johnson. We have our first question coming through in the chat. Media, as a reminder, please enter any questions you have for our panelists into the chat or direct message them to me. The first question is from Hillary Mintz at WISN 12. We noticed hundreds of available appointments each day at the Wisconsin Center this week. Has supply surpassed demand for those eligible right now? Is this part of the reason you're able to expand eligibility?
Yes, so part of the challenge has been that as we change and increase eligibility, we're catching up with our appointments. We do have appointments available at the Wisconsin Center. They have been filling up every day as the day proceeds. But in addition, that's one of the reasons why we think we're able to expand and offer more vaccine at the Wisconsin Center too. So I want to reiterate, one of the populations that is eligible right now that we're really trying to get a hold of is restaurant workers. So anyone who works in a restaurant or food distribution is eligible. And then again, as of Monday, anyone with an underlying health condition.
Our next question is also for Commissioner Johnson from Michael Spalding at 620 WTMJ Radio. Will the vaccination or testing site at American Family Field continue to operate during Brewers games?
Yes, we are working on a plan to have it operating during games, so it'll be separate from the entrance into the park for the game.
Next question is from Derica Williams at Fox 6 News. What is the current number of those in underrepresented areas who have been vaccinated? Sorry, the questions just jumped. What is the current number of those in underrepresented areas who have been vaccinated in comparison to the total amount?
So I can certainly get you specific numbers. One data point to point out is we have an extreme range of vaccinations in the county. On one extreme, we have as low as about 2% of a single census tract that's been vaccinated. And in the other extreme, we have up to 37% of a census tract that's been vaccinated. So that gives an idea of the disparities in our community. It's now public facing data on the EVE model. You can click each census tract. You can see how many vaccines have been administered. You can see what the percentage of that community has been vaccinated as well.
Thank you, Dr. Weston. Our next question is another question from Hillary Mintz. Can you discuss the racial breakdown of those already vaccinated in Milwaukee?
Is that county or city? I can start with county. So when we look at Milwaukee County, this information is also up on our dashboard. We see significant disparities. Looking at here, this is now, we do get data still weekly for this. So this is last week's data, but we have about 150,000 individuals who are white who've been vaccinated, about 25,000 individuals who are African-American who've been vaccinated, and then close to 14,000 of Hispanic ethnicity who've been vaccinated.
Next question is from Christine Flores at CBS 58. Polish Fest is the latest festival to announce a cancellation. It's been mentioned on here that case numbers are going down. Do we still see the light at the end of the tunnel?
I believe we still see a light at the end of the tunnel. I think the cancellation of festivals is really about the large number of people congregating in one place, which is still not safe. And there are still some restrictions related to these large gatherings.
Next question is from Casey Cronus at Fox 6 News. Is someone able to offer clarification for individuals who are uninsured that there are still ways to get the vaccine for free without health insurance? Additionally, is it correct that individuals who are uninsured won't need to show proof of insurance when showing up for their vaccine appointment?
This is a critical topic, and my understanding is that there's misunderstanding on this. The vaccine is absolutely free. Whether you can, I'll let Commissioner Johnson speak for the city sites, but for our site at Milwaukee County, there's no, frankly, we don't care whether you're insured, whether you're documented. We don't ask for any form of any of that. You'll never be charged for the vaccine. You'll never be charged for the administration. You'll never be charged for anything. I believe, and Commissioner Johnson can confirm, I believe all the public health departments are in that same boat. There is no charge for vaccine. It is completely free.
And that is accurate. It is completely free. There is no charge. We don't ask for any documentation, any insurance information. All of these vaccines are free.
The next question comes from Allison Durr at the Milwaukee Journal-Sentinel. There are a couple of them, so I'll try to break them down individually. Can people at the Wisconsin Center make appointments now if they have pre-existing conditions, or do they have to wait until Monday to register?
They're able to make appointments now.
Another question for you, Commissioner Johnson. Can you explain more about the upcoming health order and how much you're expecting to allow businesses to reopen?
Sure. So there will be significantly more detail that will come out on Thursday in a press release. In addition, all the information will be on our website on Thursday. The health order will be in place on Friday morning. But it really depends on the industry, but all restrictions have been open to some degree.
And one more, this one potentially for Dr. Weston, regarding the county's zip code program and its program for county residents receiving services at the community center. Has transportation been set up yet for people without a vehicle? And if not, why?
The answer is yes. I think I'll start with that we chose a site that we hope is very accessible. It certainly is handicap accessible from the outside. It also has 3 bus stops right nearby. Now, to directly answer your question, yes, for the county service users, we've called thousands of county service users. We've set up hundreds of appointments based on those phone calls, and every single person who's called is offered transportation, and that is arranged if needed.
Thank you, Dr. Weston. The next question is from Sari Lesk at the Milwaukee Business Journal. Is there any update on how, if at all, people eligible for the vaccine will be asked to verify their eligibility? Is a doctor's note required?
No, we are not asking for any verification of eligibility. It's really the honor system.
Right, and that's the same for us, and that's been the state's guidance, is that we want to make this low barrier vaccination. We're going to trust people to tell us the truth.
Another question from Sari Lesk. With FEMA taking over the Wisconsin Center, is it still limited to residents of the city of Milwaukee?
No, that's a great question. And that was one of the most significant changes when FEMA came to assist. So as of yesterday, anyone from the state of Wisconsin can get a vaccine at the Wisconsin Center.
Our next question comes from Tom Durian at TMJ4. Can we break down where people will be able to get the vaccine in the 10 targeted zip codes?
Sure. So we have many vaccination clinics throughout Milwaukee County. We have our county clinic at the Kosciuszko Community Center that you can access through covidmke.com. The city has many different sites in addition to the Wisconsin Center. They're deeply embedded, and Commissioner Johnson can talk about this, they're deeply embedded within the community, particularly the most vulnerable parts of the community. There are pharmacies, there are community health centers, federally qualified health centers. There's health systems. There's many different vaccination sites.
Our next question comes from Homer Blow at WNOV. When are children scheduled to start getting the vaccine, or is it even being talked about yet?
It's absolutely being talked about. There are several trials ongoing around the country and around the world to ensure that the vaccine is safe and effective in children. Just like in adults, all the vaccines went through the same precautions that any vaccine, any medication goes through, these multi-phase trials where it's tested on tens of thousands of people to ensure it's safe and to ensure it's effective. And that's the process that's going on right now in our pediatric populations around the country.
We have another question from Allison Durr at the Milwaukee Journal-Sentinel. For the zip code program, will officials be verifying somehow that people coming for the vaccination are residents of those zip codes? How do you prevent people from coming from other places for those vaccines?
Yeah, so for most vaccination sites and address is required. And so that'll be the confirmation for the zip code program. That address is tied into your immunization database and everything of that sort. So we're not, I should say at the county, and I believe the city as well, are not putting up barriers of you have to bring a driver's license, you have to bring your utility bill. We're not doing anything like that, but the address that's on your registration will be the verification method.
Our next question is from Susan Bentz at WUWM. Believe Commissioner Johnson mentioned people over 16 with underlying health conditions can receive vaccine. Is that correct? And if so, does that begin next week?
That is correct. And it does begin next week. The challenge with 16 age group from 16 to 18 is they can only receive Pfizer. So especially with our community sites, and I'll let Dr. Weston speak to this with the county, we are planning to have Pfizer available every day at the Wisconsin Center to assure that we can get any 16-year-olds, 16 and 17-year-olds who are registered vaccinated. We also have the intention to have them at our community sites, but that is just the caveat that Pfizer is the only one that's approved for individuals ages 16 and 17.
Yeah, and that's an important point. Thank you. So at Kosciuszko Community Center for our county site, we do have Moderna. So it's 18 years and older.
Our next question is from Drake Bentley at the Journal Sentinel. Do you believe Wisconsin should have opened eligibility to a wider population earlier? And do you believe the timing of the state's different phases has affected the speed of Milwaukee's rollout?
I'll jump in on that one. I think the state of Wisconsin has really tried to do the best it can under a very challenging situation. And I think rather than micromanage or look back, I think our intent is to look forward. And again, every step of the way, when we've been in contact with the state, they've been responsive. Do I think the timing of the state's different phases has affected the speed of Milwaukee's rollout? Yes, I do. But I think also the demographics of Milwaukee and the living patterns of people who work in the county. I think the state initially felt that a lot of the dosages that were coming to Milwaukee County, for example, to the healthcare systems, were going to people who lived in Milwaukee County, and that simply wasn't the case. You had a lot of employees and patients who use the hospital systems but don't reside in Milwaukee County or the city of Milwaukee. So I think to the extent that that was happening, I think that made this challenging. That's why I think the announcement today by the state is so significant. They recognize that there's an issue here, just as we recognize there's an issue here, and they want to be our partners to address it.
At the end of the day, we got to focus on collaboration when we're thinking about this vaccine rollout. And so, yes, I would say it has affected us, but as the mayor mentioned, they have been extremely responsive. But at the end of the day, the state hasn't been receiving enough vaccines to get the shots in people's arms who want it anyway. And so, we have to continue to move forward. I think what we've seen today from the state of Wisconsin is a step in the right direction. And I think that we're going to continue to have these conversations and making sure that we can get our most vulnerable populations vaccinated.
Next question is from Tom Durian at TMJ4. Is the Johnson & Johnson vaccine being given here in the Milwaukee area yet?
I can speak to what the Milwaukee Health Department has received. We have received a small number of J&J vaccine. We are primarily using it for our shelter and congregate settings. And we're also holding some of it for teachers if and when they go back to school that may not have enough time to be fully vaccinated with 2 doses. So we have a single dose available.
That appears to be the last question in chat. Are there any other questions before we switch over to the Spanish language version? One more question from Allison Durr at the Journal Sentinel. With eligibility opening up substantially, how much stress will this put on the city and county vaccination efforts? Besides lines, what else could be expected?
Well, I want to give another shout out to our health employees because I think that they have been incredibly hardworking over the last year. And again, this is where the partnership with FEMA is so important. By having FEMA and the personnel that FEMA is bringing to the Wisconsin Center, freeing up our health department workers to go to these other sites. That's very, very important. If it were not for that, it would be overwhelming to have us populate these other sites. So FEMA has been critical in having this happen. Having the county, for example, open its site at Kosciuszko has been very beneficial. Having other vaccinators has been very, very beneficial as well. But I do think, as the commissioner said, people might expect lines. And we're monitoring this very, very closely. If there are other problems, obviously, and I just had this conversation with the commissioner earlier this afternoon, if we have to make adjustments, we'll make adjustments. And I think that's one of the things we've learned over the last year is when you have to make modifications, you make the modifications.
And we've talked about collaboration and partnerships. I mean, is this making it stressful? I think everybody is bearing the burden is when you think about all of our vaccinators in Milwaukee County, making sure we can, again, get shots in folks' arms. And so I think the real stress comes from when you see these disparities and we know that we have to do something. That's where the stress comes in, not only just for us as government, but for many of those folks who are looking and in need of getting vaccinated. So other than what the mayor said, long lines is something to be expected, but I think that you can look at us continue to be in partnership with the city and other folks to make sure we can get this vaccine out to folks.
Any additional questions from media before we switch to our Spanish interpreter? All right, that concludes the beginning part of our briefing. Media, if you would like to stick around for the Spanish portion, we'll get started in just a couple minutes.
Thank you all very much.
Thanks, everyone.
Thank you.
Thank you.
All right, so we are going to get started with our Spanish interpreter or Spanish language responses to questions. And we will start with, or I'd like to introduce Patricia Ruiz Cantu, who will be providing the translation. We will start, she will translate Dr. Weston's portion of the briefing.
Thank you, Patricia.
Buenas tardes. En primer lugar, las cifras actuales que estamos viendo en esta medida de 63 casos nuevos al día y hemos bajado a una muerte cada 2 días. Hemos hablado y sabemos desde que de los datos semanales están disponibles que existen importantes desigualdades raciales y étnicas en la administración de las vacunas. Y basándonos en este conocimiento, nosotros en el condado y la ciudad y el Departamento de Salud hemos tomado medidas para reducir esta brecha, incluyendo clínicas comunitarias, mensajes dirigidos y programas específicos de código postal. Sin embargo, hoy en día, en el lanzamiento del modelo EVE, que significa evaluación de la vulnerabilidad y la equidad, tenemos una perspectiva más clara, no solo de la magnitud de las desigualdades, sino también de dónde se producen, y lo que permite una mejor orientación de los recursos y de los mensajes. El modelo EVE evalúa las comunidades basándose en 2 factores. En primer lugar, el índice de vulnerabilidad social de los CDC y en segundo lugar, la tasa de vacunación de la comunidad. De este modo, podemos identificar las comunidades de mayor riesgo, es decir, aquellas con un alto nivel de vulnerabilidad y una baja tasa de vacunación. Este modelo y sus resultados están ahora en línea en nuestro tablero de módulo público del condado, bajo la pestaña Modelo EVE. Y efectivamente, estos datos nos demuestran resultados muy preocupantes. A la luz de estos resultados, nos complace haber trabajado con el Estado para hacer frente a estas tendencias. El Estado está trabajando para hacer frente a estas desigualdades de frente al adelantar la fecha de elegibilidad para aquellos con condiciones crónicas al próximo lunes 22 de marzo, una semana antes de lo previsto inicialmente. Esto introducirá una vacuna extremadamente efectiva y segura para muchas de nuestras comunidades. Sin embargo, queremos dar un paso más. Entendemos que en el condado de Milwaukee, al igual que en otras innumerables partes de nuestro país del mundo, el racismo sistemático afecta a las vidas de nuestros ciudadanos de múltiples maneras. Además de los efectos financieros, sociales, tienen efectos claros de salud de las personas que viven en las comunidades más afectadas. Por ello, al considerar las conexiones entre la raza, la etnia, el estado crónico, la desigualdad sanitarias y en última instancia los peores resultados de salud, incorporamos estos impactos sanitarios en las condiciones de salud que son susceptibles de ser vacunadas, utilizando los criterios validados y ampliamente utilizados de los de CDC, del índice de vulnerabilidad social. Abriremos la elegibilidad para la vacuna a los 10 códigos postales más vulnerables del condado de Milwaukee. Estos 10 códigos postales se encuentran en nuestro sitio web de vacunación del condado. También lo pueden encontrar en covidmke.com. En este sitio usted puede ver también a partir de ahora y programar su cita para su vacunación en nuestro sitio, en el Centro Comunitario de Casiasco. Para ser claros y para resumir, a partir de este lunes, cualquier persona con una condición de salud reconocida por el Estado puede ser vacunada. Esto incluye los que tienen incluso un leve sobrepeso. El condado de Milwaukee, para hacer frente a esta desigualdad en nuestra comunidad, a partir de este lunes, en estos 10 códigos postales, cualquier persona mayor de 18 años, puede vacunarse, puede ir a covidmilwaukee.com para programar su cita ahora, pero somos uno de los muchos sitios que usted puede programar su cita. También puede visitar uno de los muchos sitios de vacunación de la salud pública, atención médica, centro de salud comunitario y farmacias del condado. Compruebe sus respectivos sitios web para entender mejor su elegibilidad geográfica. Continuamos siguiendo estas disparidades o desigualdades. Ahora tenemos una herramienta con el modelo IF para dirigir más deliberadamente nuestros mensajes y nuestros recursos. Las desigualdades están ahí, son reales y están muy marcadas. Será un reto, pero el módulo IF junto con el programa de código postal será un apoyo enorme para mejorar la equidad de la vacunación en nuestra comunidad. Gracias y manténganse seguros.
We do have 3 questions from Christina Flores at CBS 58. The first question is, what should people in the 10 eligible zip codes do now in order to get a vaccine?
So if you live in one of the 10 eligible zip codes right now, I would register to get the vaccine. The 2 probably most straightforward options at the moment are through Milwaukee County Office of Emergency Management at covidmke.com or through the City of Milwaukee at milwaukee.gov/COVIDVAX, VAX.
Cristina, ¿me puedes hacer la pregunta en español, por favor?
Can you guys hear me?
Yes.
Ok, bueno, Pati, dinos, ¿qué es lo que personas, bueno, ha mencionado que hay 10 códigos postales donde personas son elegibles, comenzando, se me hace el lunes, donde ellos pueden ir ya a agarrar la vacuna. Si ellos viven en esos códigos postales, ¿qué es lo que deben hacer ahorita para poder recibir esa vacuna?
Ahorita pueden ir directamente a la página de internet del condado, que es covidmilwaukee.com, y pueden hacer su cita inmediatamente en la página del condado o en la página de la ciudad de Milwaukee.
The second question is, can you please explain the qualifications needed for the vaccine? Do people need to show proof of insurance or residency? Also, please clarify the price for a vaccine.
So speaking for Milwaukee County, and Commissioner Johnson is on as well, and all of the health departments, none of the health departments, the county site at Kosciuszko Community Center, no one is charging for the vaccine. There is no insurance needed. There's no proof of insurance needed. There's no identification needed. There's no immigration status needed. Everyone who lives in these zip codes is welcome, 18 and older, to get vaccine. And in general, anybody who meets other eligibility criteria is welcome to get vaccine as well.
I'll translate that. Para la información que se necesita, no tiene ningún costo la vacunación. Pueden ir al centro comunitario de Kosciuszko. No tienen que presentar alguna identificación, no tienen que ser residentes permanentes o tener un estatus migratorio. Simple y sencillamente tienen que ir a hacer una cita y presentarse. Okay.
I believe that is that is all of Christine's questions. Christine, did that cover your questions?
Yes, it did. Thank you.
Okay. I believe Me Wisconsin also wanted to ask a few questions. So Me
Thank you.
Wisconsin.
Yes, thank you so much for making this press conference in Spanish. Gracias, muchas gracias. Bueno, mi primera pregunta es, ¿cómo el doctor Benjamín y su equipo están midiendo la vulnerabilidad de la población en riesgo y sobre todo de la vulnerabilidad de la comunidad latina, que es una de las más infectadas en la ciudad de Milwaukee?
This question is, well, first of all, thank you for doing this in Spanish. And this question is for Dr. Benjamin. Dr. Benjamin, how are you seeing the vulnerability for the Latino community and how they're being affected?
Yeah, thank you for the question. So throughout the pandemic, we have certainly seen the Latino community in Milwaukee County, as well as communities around the country, significantly affected by the COVID-19 pandemic, affected by the number of cases, the number of hospitalizations, as well as the number of deaths. In Milwaukee County in particular, we see that when looking at the social vulnerability index, the zip codes that are clustered around the south side of the city of Milwaukee, which is a largely Hispanic population, does have higher levels of vulnerability. And unfortunately, that's paired with lower levels of vaccination. Now, there are a number of different sites serving that community. 16th Street Community Health Center has their clinic right in the heart of that community. The Milwaukee Health Department has embedded themselves in that community. And Milwaukee County at the Kosciuszko Community Center has embedded in that community. So we hope that this expanded eligibility, not just to those with health conditions, which by the way includes even being slightly overweight, but those in these 10 zip codes are now anyone 18 years and older are eligible. And so we hope to have this be a specific community that we can target to receive what has been proven to be an extremely safe, extremely effective vaccine.
Muchas gracias por hacer esa pregunta. Lo que hemos visto de la comunidad latina, no solamente aquí en el condado de Milwaukee, sino en todo el país, es que el número de casos del contagio han sido muy altos, también de hospitalizaciones y de muertes. Lo que hemos visto específicamente en la ciudad, en la parte sur de la ciudad de Milwaukee, es que sí, que los casos son altos. Hay varios lugares donde pueden programar sus vacunaciones. Tenemos ahí a la clínica de la 16, el centro de salud de la 16. También tenemos el centro de salud pública de la ciudad de Milwaukee. Y ahora el condado va a tener el centro en Kosciuszko, en donde está el centro comunitario de Kosciuszko, en el Kosciuszko Park. Esperamos que esto sirva para que no solamente las personas que tengan alguna vulnerabilidad o alguna enfermedad puedan ir y beneficiarse de la vacuna. Lo que estamos viendo es que también las personas, aunque estén un poquito subidas de peso o que su peso que estén un poquito gorditas, pueden también calificar ahora para la vacuna. Entonces esperamos que esto ayude a cambiar esa vulnerabilidad y podamos tener mayores números de personas que se vacunan.
Mi segunda pregunta es, en estos momentos los números de las personas vacunadas, sobre todo en la comunidad hispana, son bajos. ¿Hay alguna estrategia de comunicación o hay alguna estrategia para poder que esos números que son bajos todavía empiecen a aumentar, empiece la gente a vacunarse? ¿Saben por qué razón no se están vacunando?
My second question is, knowing that the numbers of Latinos being vaccinated is low, is there a strategy or a plan to get those numbers higher? And is there a reason that we know of why they're not getting the vaccine?
Great question. So starting on, and Commissioner Johnson can certainly expand on this from the city's efforts, but from the county end, there's a number of different avenues we've gone down. We're focusing on more targeted messaging to the Hispanic community in Milwaukee County. We've set our main county site up right in the heart of the south side of the city of Milwaukee at Kosciuszko Community Center. We are working with the most vulnerable members of our community through our county service programs to target specific community members, offer them over the phone the opportunity to register, the opportunity to schedule their appointment and receive transportation. And then we're working to get more and more Spanish language interpreters on site as well, where we are at Kosciuszko Community Center. And I believe the Milwaukee Health Department has made similar and even more expanded efforts on those fronts.
Muy buena pregunta, gracias por preguntarla. Quiero decirles que sí queremos, estamos buscando la manera de cómo mandar más mensajes específicos a la comunidad. También lo podemos ver con los sitios en el centro de la comunidad latina. En el condado, por ejemplo, es en el Parque Kosciuszko. También en la ciudad de Milwaukee, en el centro de salud del sur de la ciudad. También estamos nosotros trabajando el condado para tener personas bilingües que puedan agendar las citas para la vacunación. Les estamos proveyendo transporte y también estamos viendo que la ciudad también ha hecho algunos de estos y muchos más mensajes específicos en español. También estamos buscando de tener más intérpretes, más personas bilingües en el centro de vacunación en Kosciuszko.
Y mi última pregunta es relacionada con... Okay. Mi última pregunta sobre la vacunación es, la comunidad latina, muchos de nuestra comunidad, nuestras familias trabajan 2 o 3 trabajos. Muchas veces los horarios están por fuera de los horarios de vacunación. ¿Existe alguna posibilidad de que se extiendan por fuera de las 6 de la tarde o en la noche la vacunación o los fines de semana?
This is my third question. A lot of our people in our community have 2 or 3 jobs outside the work, the hours of the vaccination. Is there a possibility that they could set up times after 6 o'clock or outside hours for people to come and get the vaccine?
I can speak for the Milwaukee Health Department. Yes, we can certainly work on that. Again, we just stood these up today. I think as we move forward, we'll be making some adjustments, but I will definitely bring that back. And I think that's an absolutely valid and critical point. We want to make sure there are no barriers and that people who want access have it.
Claro que sí, yo voy a hablar de parte de la ciudad y sí podemos hablar de eso y acaba de empezar hoy, pero vamos a buscar la manera para que nuestra comunidad vulnerable pueda ir a ponerse la vacuna.
Thank you so much for this press conference in Spanish. Thank you.
We can do a last call for questions for translation into Spanish. Last call. All right. Thank you so much to Patricia for the interpretation, and thanks to everyone for joining us on the briefing today. We'll be back on Thursday.
Thank you.
Thank you.
Thank you.